All
Oh,
right, good to go.
Okay, great. So I'm Annette, and we have Malcolm and Evan on the call. They're my co-residents, also PGY3s, and then we also have one of our twos who just started, Dr. Johnson Ho. He's also in on this call too. So next slide. So yeah, so our accreditation status, we are accredited with commendation. We have no citations. Next slide. So residents and core faculty. So in the first row, we have pictured here some of our core faculty members. From left to right, we have Dr. Bale. He's at inpatient and clinics at Kings County. Next to him, we have Dr. Agarwal. He's our division chief at Downstate Hospital. And then next to him is Dr. Stickevers. She's our program director. She's been doing this job for 19 years as a program director, so she's very good at her job. And next to her, we have Dr. Kiefle. He works at Kings County in the inpatient and clinics there. So you can see in that big group photo there, we have a pretty large class. We have 21 residents total, 7 residents per year. And just so you're aware, you must complete an internship at an accredited hospital before entering our program. We are an advanced program. So our clinical affiliates, so our main hospitals are SUNY Downstate, which is in Brooklyn. Right next to Downstate is the Kings County Hospital. It's right across the street. And then in Queens, we have St. John's Episcopal Hospital, Staten Island University Hospital. And then this year, we're getting 2 new affiliates, the Bronx VA, SCI Center, and the Manhattan VA. So every year, we're making changes to our program to improve. We're adding new sites based on feedback. And that's something I really appreciate personally from this program, is that anytime we get feedback, the attendings, they will go above and beyond to make changes to improve our program. So I'll start off by talking about our main hub, which is the SUNY Downstate campus. So here we have an inpatient unit, we have outpatient clinics, consult services, and we have a sports medicine clinic and interventional pain management that we do here. So just to give you an overview of the Downstate inpatient. So we have an inpatient unit, which has 18 beds. We have a PA, as well as an internal medicine consult attending that help us run the service. So it's going to be 1 resident covering about 10 to 18 patients, and then that you have good support there. We also have 1 PGY3 who will be doing consults during the time there, and then we have 5 residents in our outpatient clinics. So in our outpatient centers, we have really great exposure. We have good experience with ultrasound and EMG's nerve conduction study. We get really hands-on exposure when it comes to interventional pain procedures. We also have a very good PM&R clinic where we see outpatient follow-ups from our patients that we discharge from the inpatient unit. We get good PNO, prosthetic and orthotics exposure here. And also in our sports medicine clinics, we have sports medicine attendings that do ultrasound-guided injections and will train us in that. We also have good Botox exposure. Sorry, can you go forward one slide? Yeah, so this is a picture here of some of our residents practicing on a mannequin that has a spine and doing spine injections. So every once a week when you're in the Downstate clinic, you'll come in an hour early at 7 in the morning and you'll do some practice injections, epidural steroid injections on a spine model. And that's really great exposure for us before we start injecting patients. So I'll pass it on to Evan, who will talk about Kings County.
okay. Hello, can everybody see me? Hello?
Hey, Evan. Yes,
Hey,
we can hear you and see you.
Okay, perfect. This is basically, I'm here to talk about Kings County, which is one of our affiliate centers. It's one of the oldest hospitals in Brooklyn, founded over 125 years ago. We have a lot of experience there in EMG, musculoskeletal ultrasound. It's also a level 1 trauma center. We see a lot of traumatic spinal cords as well. Next slide, please. So basically the Kings County rotation, there's 5 residents total. We have 25 inpatient beds. We have our outpatient clinic where we do injections, a wheelchair clinic as well. We have a lot of stroke, spinal cord, musculoskeletal injuries. We see a lot of just general PM&R, as well as trauma here. Kings County is a level 1 trauma center. We see pediatric PM&R as well. A lot of EMG, like I said before, wheelchair clinic. We have a lot of prosthetics and orthotics, and we get a lot of ultrasound experience. Next slide. So the call schedule at Kings County is a PGY2, you have 5 calls per month. As a PGY3, you have 3 calls per month. And at PGY2, you have 2 calls per month and no weekends or holidays. And so the calls are shared between Downstate and Kings County. So next we have St. John's Episcopal Hospital, which is in Far Rockaway in Queens. It's right near Nassau County too as well in Long Island. And here we do inpatient, we don't have an inpatient here, I'm sorry. We have outpatient clinics where we do EMG. We do some injections as well there. And we do consult service as well. And while you're here, there's no call at nights and no call on the weekends as well. Next slide, please. Okay. So again, rotations at St. John's Hospital, Episcopal Hospital, is 5 residents. We have our outpatient clinic. We have a general consultation service where we see consults in the hospital as well. We see prosthetics and orthotics, a lot of EMG there. We do see pediatric consults, and basically we get to have electives while rotating at St. John's. So we're allowed to go to other institutions, and actually not now because of COVID, but before we were able to go rotate in outside institutions during that time. Next slide. No night call, like I said before.
Hey guys, so my name is Dr. Malcolm Winkle. Just want to speak to you guys about Staten Island University Hospital. So it's one of our main rotating sites, and this as well, in addition to Kings County, it is one of our level 1 trauma centers where we see like a variety of pathology ranging from orthopedics to neurosurgery into neuromuscular stroke pathology as well. It's a CARF accredited institution. So at this site, we're going to be transitioning from four residents to about 2 residents. And so here we're going to be seeing things like TBI, spinal cord injury, stroke, medically complex, and Staten Island is the only burn unit on Staten Island. So that's one of the benefits of seeing rehab there. While on call, there 1 resident is assigned to take call on the weekdays until about 6 p.m. or about 7 p.m. And then afterwards, the on-call hospice will be taking the calls for our unit from 6 p.m. until 7 a.m. the next morning, and then 2 residents will be covering the site on the weekends, Saturdays and Sundays, from 7 o'clock until about 7 p.m. So the curriculum is a 18-month in duration curriculum, which repeats twice between the PGY 2-year and the PGY 4-year. Teaching takes place in the form of didactics, lectures, workshops, journal clubs, and practical experiences, plus also board reviews. And lectures will be held between 1:30 and 5 p.m. At Downstate every Thursday, which is something which our program director, Dr. Stickover, takes very, very seriously. So in addition to that, though, we also have 3 mock written board exams, plus also 3 mock oral examinations, just to help prepare us for the essays, plus for the actual board examinations. So the curriculum is very broad ranging. So it pretty much prepares you for the full spectrum of what you're gonna be seeing in clinical practice, plus also on your examinations. So it ranges from modalities, neuromuscular, EMG, TBI, P&O, pediatric sports, pain and spinal cord injury. And so across each site there's various exposure to different procedures like EMG, Botox with Dr. Francisco, who's a board certified neurologist and neuromuscular specialist, ultrasound guide procedures, interventional spine with Dr. Agarwal here, radio frequency ablations, and also fascial joint injections, amongst other procedures, also peripheral joint injections and bursa injections. And all residents will be evaluated 2 times throughout the year during your rotations for the mid-rotation evaluations. And all evaluations will be available for review 24/7 through our main website, New Innovations. And residents will also be evaluated by their peers, patients, and members of the administration, so there's proper follow-up, and so that we we understand that we are becoming better clinicians throughout each rotation.
Okay, so I'll discuss research and scholarly activity requirements. So residents are required to have a minimum of 1 poster presentation during their time at Downstate. This is not a problem for us at all. We always get the opportunity to come across interesting pathology, whether you're inpatient or in consults or even in clinics or doing EMGs, nerve conduction studies. And we have our residents submit to AA, PM&R, AAP multiple times during their time here. Next slide. Yeah, and we also get reimbursed for the cost of attending these conferences. So they cover up to 2 conferences. We've also had our residents publish in a wide variety of journals, including orthopedic journals and PM&R journals. And we actually are rated top 10% of PM&R residency programs for publication. Next slide. Yeah, more of our publications. Next slide. So our recent presentations at national meetings, so these include PM&R, AAP. We try to get our residents published during their time here. Keep going. Yep, keep going. These are all within the past few years that we have listed here. So we are given a bunch of books that are helpful for board review as well as for day-to-day reviewing. So we are given them in the form of an ebook. We are given an iPad, I believe it's an iPad Pro that we're given, and we get that during the start of our PGY2 year. We have all these books saved on our drive that we have access to throughout our time here. Continue. So benefits. So this is part of. Sorry, I'm getting paged. I'm actually going to ask Malcolm. Do you mind taking over?
Sure thing. So some of the benefits include health insurance for both the resident plus their families, 4 weeks paid vacation, paid sick leave, malpractice insurance, and paid holidays as well. Plus, we also get a $1,000 stipend for books upon entering the program. The stipend can also be used for the national conferences, and our PGY4s have paid expenses for the Kessler board review within the PGY4 year, and just like Dr. Luco said, we also get free iPads for the use of our residency plus beyond. We also have a ACGME, accredited PM&R sports medicine fellowship that is under the direction of Dr. Christine Broussard, our family medicine attending. And one of our best aspects would be the PSAL program, which is where we cover the high school sports within Brooklyn, Queens, and the Bronx. So starting in PGY2, you're basically serving as like a sideline sports medicine physician who is treating so acute injuries, musculoskeletal, plus also concussions right there. Plus this is also a paid opportunity, which we get. But through this, you can get up to 20 games and everything just to be right in the midst of football game coverage for both junior varsity plus also varsity sports as well. So it's a very, very valuable opportunity. We actually got to serve some games at Meadowlands Stadium this past year, but because of COVID, like a lot of things have really been turned down. So we're just waiting for proper confirmation. But football is not the only game coverage we get to do. We also have a partnership with USA Metro Boxing Circuit, which is the preliminary service for getting into the Olympics through the tri-state area.
We have about 5 minutes left.
Cool. So this is some of the other teams we cover as well, and there's multiple mentorship opportunities between the PGY 3 and 4 years. So everyone's partner up so that everyone can get a fair opportunity to get proper placement within a fellowship or future attending positions. And there's resident wellness as well, in addition to the Diversity and Inclusion Committee, which is run by me and Dr. Luca. So we have multiple events for resident wellness throughout the year through like park visits at Central Park, Prospect Park, Park, just meeting up with friends. We also have the acupuncture certification, which is only $5,000 here, and it's one of the only programs within the country to be doing this through a PM&R department as well, which is very subsidized for us. And we also have our own Instagram page. So there goes Dr. Johnson, right, Prospect Park, our full residency house staff on the top left, a photo of me in the bottom left, and some of us doing Botox injections, and our recent sports fellows at the sports conference this past March.
Okay, so basically a day in the life. Why Brooklyn? Why Downstate? So you know, Brooklyn is basically really exciting area. There's a lot of it's close proximity to the city. It's close proximity to Long Island, even a little bit to New Jersey as well. There's plenty to do. You can always go into the city, go to eat basically wherever you want to go. All kinds of food available, anything you can imagine, and it's available at any time of the day. Also, we get a lot of just like shows, a lot of events that are happening. There's always something happening in the city and in Brooklyn, and there's always just excitement, and you have there's a lot of fun to live in the city, and I really enjoy it. Malcolm, do you have anything to add?
So for me, Downstate's program really stuck out to me because of how much autonomy like we already had starting off within our PGY 2-year, not just on the inpatient side, but also the outpatient, in addition to the sports aspect. So for me personally, I would like to apply for sports medicine fellowship in the future. But the thing is, like, starting off within like second month, you're already right in the midst of football coverage, boxing coverage, and just putting things into practice in terms of MSK, spinal
You
cord,
have 2 minutes left.
right, for young people and everything. So in addition to that, the board review course with Dr. Stick Evers is phenomenal. Very high board pass rate, and we can talk about it further, but we want to let you guys say some questions to us first. So we'll just check the chat real quick. You see any questions in that?
No, I don't see any questions.
Cool. Go for it. Let me check the chat.
I can also add that I feel that we get a solid training at Downstate. Our graduates, especially our recent graduates, have done very well with the match for ACG&E sports as well as pain fellowships. So I feel that the residents that train here will come out of here strong and do well whatever they decide to do. Yeah. Oh, cost of living. Someone's asking about that. Yeah. So cost of living is tricky. You're living in Brooklyn for the most part. Most of our residents either live in Brooklyn, Queens area. So I would say, depending on where you live, I live close to Downstate. I pay about $1,000 a month, but I also have roommates. So that's how I would say my cost of living is. And other residents, they live all across Brooklyn, some in Staten Island, some in Queens. And for sports coverage, yes, you can go beyond the required 4.
Oh yeah, absolutely. And just to address research, like we're the only academic institution within Brooklyn, so we have anesthesia, orthopedics, plus also a neurology plus neurosurgery department. So in addition to our own PM&R department, so there's multiple ways to get into some sort of project. Plus also there's the graduate studies program as well, just in case you want to do case reports or
all right, guys, I'm sorry to interrupt, but your time is over.
No, thanks.
We appreciate your presentation today, and encourage you guys to share your email again, so in case they have any further questions, they can reach out. Thanks so much.
Thanks, man.
All right.